I'm Dr. Lora Shahine. Welcome to my YouTube channel. Today we're going to talk about tips for success with your IUI. I'm Dr. Lora Shahine. I'm a reproductive endocrinologist, fertility specialist, helping people build their families for over 15 years. And today I want to educate you all about the IUI and how to maximize your chances for success. At the end of this video, I want you to understand what an IUI is and ways that you can improve odds for success and walk away with a true understanding for what the success rates are. So let's get started. First of all, I really want to thank you for your comments and questions that you brought up. If this is your first time finding me on YouTube, welcome to fertility education. I love teaching people what they should have learned in health class. And if you've watched a few of my other videos here, thank you for coming back. I really want this to be an educational space for you. Your comments help me figure out what you want to learn about. Be sure that you like this video, you subscribe to this channel, and you comment with questions and things that you want to learn. So first of all, what is an IUI? An IUI is an intrauterine insemination. It is a fertility treatment, and it is often referred to some of my patients with a little bit of a giggle. They call it a turkey baster because basically you're taking ejaculated sperm, washing and prepping it, and then placing that sperm into the uterine cavity around the time of ovulation. And this is a technique. It's pretty low tech in that everything's still happening inside of the body. So sometimes people get confused with acronyms and, IUI versus IVF. IUI, intrauterine insemination, placing sperm into the uterine cavity around the time of ovulation. And IVF, totally different. In vitro fertilization, that's where we give medications. We're trying to recruit a lot of eggs, extract the eggs from the body with a simple procedure called an egg retrieval, fertilize eggs and sperm outside of the body. And then when the embryo is ready, placing the embryo back into the uterine cavity. So I have lots of videos here on all the different steps of IVF. I have a great video on intrauterine insemination versus in vitro fertilization, IUI versus IVF, and how people can learn and ask questions to figure out which treatment is right for them. This video is you want to learn more about IUI, or you are planning to do an IUI and you want to maximize your chances for success. Or maybe you've done an IUI or two and it is not being successful. You want to think about different options about how you can improve your odds. People are using IUIs for lots of different reasons. Certainly, if someone is conceiving with donor sperm, then an IUI is a great way to help get that sperm near where it needs to be around the time of ovulation to help you conceive. Some people are using it as a low-tech fertility treatment, either for unexplained infertility or helping improve the odds of success with some other treatments, or even mild male factor, meaning there's a low-ish or borderline sperm count, low-ish or borderline motility, and an IUI can help prep the sperm and really get it past the cervix closer to where it needs to be. Now, you do have to have a certain amount of sperm to do an IUI. I do see patients sometimes that do have sperm in the ejaculate, but a very low count, like less than 1 million, maybe less than 2 or 3 million. And in those cases, it is very unlikely to be successful and to get pregnant with an IUI. And so sometimes, of course, if there's no sperm or if there's very, very little sperm, sometimes my patients are going straight to IVF, and IUI is really not an option. So be sure to review that with your doctor. So in general, what happens during an IUI cycle? Well, you're typically just trying to get sperm where it needs to be around the time of ovulation. And so it's timing that placement. Sometimes people will follow their cycles with ovulation predictor kits, call the clinic with a positive kit, and do the insemination the next day. Sometimes people are using ultrasounds to help monitor, even trigger shots to help time the insemination. But you're trying to figure out when ovulation is happening and then placing the sperm after it's been washed and prepped where it needs to go. Words of wisdom, 3 things to think about before you get started. Number 1, get testing. Number 2, review your goals with your doctor. And number 3, really make a plan. So what I mean is think about testing. You might not have any symptoms, you might not have any risk factors, but sometimes people do have blocked fallopian tubes and they just don't know it. There's no symptoms. So talk to your doctor before you do your first IUI about whether or not you should do an HSG or a hysterosalpingogram. I always do this when I'm talking about it because I think about the fluid flowing through the fallopian tubes to make sure that they're open. And HSG, I've got a great video here where you can learn all about that test. Number 2, think about your family goals and talk to your doctor about your goals and your personal situation. Some of my patients bypass doing IUI and go straight to IVF because of their personal situation, in that maybe they're starting later in life. They're worried about the difficulty with having adding to their family in the future if they know they want to have more than one child. Common scenario could be a couple that's starting in their late 30s, early 40s. They know they want to have 2 or 3 kids. It might be easy to conceive with your first IUI, but maybe harder as you're trying to add to your family. And you can use IVF as a fertility preservation. I've got a great video where I'm talking about trying to decide between IUI and IVF, and I go into this discussion and thought process in detail. Check that out. And number 3, make a plan. You don't have to stick to it, but it's, not every IUI is going to be successful. So it's really nice to talk to your doctor about how many of these are we going to try? When do I need to think about, having another return visit with you, or think about maybe moving on to IVF or trying something different. It'll decrease your stress if you have a little bit of a plan before you get started. So the 5 tips to think about and how to maximize your success with IUI. Number 1, think about adding medication. So if you are having regular, predictable menstrual cycles, you're most likely ovulating, but you can add simple medication at the beginning of your cycle to help recruit the best eggs and optimize your chance of success. Talk to your doctor about using either clomiphene, or the other word is Clomid, or letrozole, and then the brand name is Femara. These 2 medications are pills that you can take for about 5 days towards the beginning of your menstrual cycle that helps with egg recruitment. It also helps optimize hormones in the luteal phase, so you have a higher chance of implantation. Personally, if I had to choose between Clomid and letrozole, I often opt for letrozole because there's typically less side effects. Clomid can often result in headaches and mood swings, sometimes even vision changes, and it can build up in your system over time and cause an increased risk of ovarian cysts or even a thin endometrial lining. So I often talk to my patients about choosing letrozole as a first step because it doesn't have the typical side effects of Clomid. Number 2, consider monitoring your cycle with ultrasounds. So one way to time intrauterine inseminations is to do ovulation predictor kits. That is much less expensive than doing ultrasounds. If you know that they work for you and they're consistent, that can be a great way to decrease cost in your care. But I often talk to my patients about doing ultrasounds because I don't want to miss anything. Doing an ultrasound in the middle of your cycle helps you make sure that there is a mature follicle with a mature egg. And it also helps us pick up on little issues. Like we always look at the thickness of the uterine lining and are trying to kind of optimize timing. So there are different ways to time an IUI, but think about using ultrasounds to monitor, especially if it's the ovulation predictor kits are not working for you, or if you have tried it simply with ovulation predictor kits a couple of times and it hasn't been successful. Think about looking in the middle of the cycle with an ultrasound to gain more knowledge and optimize your timing. Number 3, think about adding a trigger shot to your protocol and your regimen, because in the middle of the cycle, the way the egg ovulates, the pituitary gland makes luteinizing hormone to talk to the ovary to get it to ovulate. And a lot of times our body is doing a great job of doing that, but sometimes if we add a trigger shot, it not only really lets us know when you ovulate and helps us time the intrauterine insemination, but it also encourages your own ovaries to make more of their own progesterone for at least a week after that shot. So it also helps optimize the luteal phase, or the second half of the cycle, when an embryo is implanting. Number 4, optimize the sperm counts and the sperm parameters. So especially if you're doing IUIs because there's a mild male factor or a moderate male factor, off like borderline counts, borderline motility, try and figure out why. Try to optimize the counts. You can do this before you even start doing IUIs, or if the first one or two IUIs is not working, think about ways you can improve counts and improve your overall health. Things that you can do, or you can do hormone testing. You can see a male fertility urologist for a little bit of a checkup. Think about medications that you're taking. Think about lifestyle optimization, like limiting, no tobacco, really very rare alcohol. Marijuana has been shown to decrease sperm count, sperm motility, et cetera. Make sure you're getting sleep, stress management, all of these things. But really think about your optimizing your health and getting the best sperm parameters possible to increase your chances of success with IUI. And number 5, this goes for the female partner as well, or the person with ovaries and a uterus. So optimizing your health will optimize your reproductive health. And I have a lot of videos here on nutrition, on fitness, on the importance of stress management. So we can't eliminate stress. We can't cut it out of our lives, but we can learn how to manage stress, self-care, as ways to decrease its impact on our overall health and well-being. So let's recap. What are the 5 tips for improving your success rate with your IUI? Talk to your doctor about these, but you could consider adding medication like letrozole or Clomid. Number 2, you could add monitoring to the cycle in the middle of the cycle, double checking the follicle size, the uterine lining, making sure everything is ideal. Number 3, you can add a trigger shot to the protocol as a way to time the insemination and improve the production of estrogen and progesterone in the luteal phase to help with implantation. Number 4, you can optimize the male factor, the sperm health, if you are doing IUIs for mild male factor or for unexplained infertility. And number 5, that goes for both partners. So reproductive health is essential, and think about all of the ways you can optimize your health to improve your chances of success with IUI. The chances of success with one IUI are not more than 15 to 20% each time you try. And that might be even lower in certain circumstances. As the eggs and sperm age, like as we get closer to 40, the chances might be even lower than 5%. And so it's important to realize and set your own expectations for the chances of success. I want all of my patients to get pregnant and have a baby with their very first IUI, but I want to help them understand the chances of success, setting their expectations, and helping them realize that it really might take more than one IUI. So if the first one doesn't work, talk to your doctor about options, but more than likely you're going to try again. And I truly hope that it is successful for you. I hope this video is helpful. Like this video, comment with questions that you have, subscribe to this channel, and stick around for more learning.